So we thought that'd be a great transition to those who work with fitness and exercise. The team from Mount St. Joseph University, they partner with us usually for something we call Ask a Nurse, but today we are asking someone who specializes in health and exercise science. So I'm going to call you BC, but tell us a little bit about what you do at the Mount.
So I'm the department chair and associate professor for exercise science and integrative health. I'm an athletic trainer by training, and my doctorate is in exercise science and physiology. And we have a program for students who are interested in clinical exercise medicine, who are interested in sports performance and active aging, and then also health promotion.
So two reasons we wanted to hear a little bit more about those. I'm guessing even with especially COVID, the interest in those has grown, has it not?
Absolutely. The evidence indicates that being active and being physically active is very much protective against the adverse events that are associated with COVID infection, but also we just have to know that being active and reducing sedentary activity has so many benefits across the entire lifespan. And so individuals who can help other individuals be active, who can advocate for exercise and physical activity, we just need more of those individuals. And so it's a wonderful undergraduate degree, and it also helps people go into other health professions.
Yeah, we have a saying that health doesn't really mean anything until you don't have it. Yeah.
Absolutely.
And then you figure out how important, it's why they told us to exercise. All right, well, we have a couple things. I know you shared with us just some graphics about simply the program and what that is. So I want to just you told me there's sort of 4 areas that I think are fascinating. A lot of people may know about exercise science and sports performance, but health promotion and then combining that with athletic training and whatnot, whoever thinks to say, hey, where would you use that? How would you use it?
Health promotion is a umbrella term for advocating for all of the determinants of health. So if it's mental health, physical health, emotional, spiritual health, and assisting communities to enhance their well-being. Oftentimes those programs will be in the communities in which they serve, and it also ensure that we have all of the things needed for us to thrive as a community.
Yeah, and I know we have some video. You have a new building, for lack of a better say, that's a whole athletic center.
Yeah, our Knowlton Fitness Center and our Centennial Fieldhouse just opened this past year. We have students who are involved in health assessment, exercise prescription. We are advocating that individuals exercise across the lifespan from early childhood all the way into an active retiree. And it really does mean that individuals need to perhaps decide to be active. And so we want to facilitate that.
Yeah, the decision part is always the hardest part, isn't it? All right, so part of the reason we wanted you here is we're starting that time between Thanksgiving and the New Year where most of us just slack off. So what do the people do that don't slack off? That's really what we wanted to ask you.
So honestly, becoming physically active is a part of a lifestyle. And so choosing to do small incremental steps to be active, involving family, friends, and coworkers in your activities, also just having some decision prompts that help you, whether it's choosing to take the stairs, whether it's choosing to get up every maybe every half hour while you're at home. With COVID, everyone was kind of working, and that obviously individuals have to be at their desks or what have you, but you can also stretch. You can also be kind of set a timer for yourself. Anything you can do to be active demonstrates a better health benefit. Also building in that time as a gift to yourself and a gift to others, because if you're active, you're going to be available both mentally and physically to others. And so we want to make sure that people are thinking in that way.
You know, that is an interesting way to put it, because if you think of it sort of as selfish time, if you take your own time to exercise. So I do want to put what's happening in health graphic up, because I know we have a link to your programs and that, but I always have to ask, so what is your workout routine? Because that's probably the thing you get asked most, huh?
So honestly, I am not one person that likes competition. I like to be outside. I like to go hiking. I do want to point out that there's wonderful resources here in the community for us to be outside, even when it's cold. But for me, I like paddling, I like camping, I like hiking. I was the lowest string person on any competitive team that I ever played on, and so I like being in the outdoors and doing activities of that type.
That's fun, because you ended up in exercise science, of all the ironies. Well, it is a pleasure to meet you, share about your program.
Thank you.
And as we mentioned, if you want to find out about them, just go to whatshappeninginhealth.com. Thanks for being here today.
Thank you very much. I appreciate that.
Yeah, great job.